really trying to target people who are in the rural areas, people who don't have transportation, and people who, of course, don't have a family doctor. In the area when we first started, we had no labs, we had no pharmacy, we had no primary health care, and now we have primary health care services. So we do chronic disease management, well baby checkups, well woman, well male. We've also had services like dental hygiene here. So it's whatever the community wants, and each community will be a little bit different. So that's the idea of the hubs, is that we can bring in professionals that the community needs.
I think most people within our community and the surrounding area are absolutely delighted with not only the facility, but the staff as well.
I had a family doctor in Barrie, and he retired, and with the problem there, you're waiting 6, 7, 8 weeks to get an appointment, and here it's been, the access has been incredible.
A couple of years ago, Dana discovered that I had an aneurysm. She directed me to a very nice doctor in Barrie, and my aneurysms were repaired. So as far as I'm concerned, she saved my life. And then she saved my life a second time when she discovered I was short 4 liters of blood. Not only did she save my life twice, but she probably saved it a third time, because I quit smoking June 2nd, the night before my aneurysms were repaired, and have not had a cigarette since.
Even if you have something as simple as a throat infection or a virus of some kind, you have to go to emerge, and that's not good for the hospital, and it's not good for the residents either.
And trying to find a family doctor was impossible, and they had to go to the hospital a few times just for general, traveling, especially in the wintertime. I mean, that is scary in itself. So if it's in this area, people will be able to get here, and I think that's important.
We had one couple in particular who donated the funds to actually outfit the entire room, including all the medical equipment that we have that's needed to run. So we were very lucky. Mobility being an issue, and with distance being an issue, it could provide a lot of life-saving opportunities for the community.
Offer primary care for people who don't already have a primary care provider in the area. Plus we provide episodic care for seasonal visitors, so we're expecting to see a big increase over the summer months. 90% of the people that we have taken on either don't have a healthcare provider, or they are homebound and can't access their healthcare provider. But there have been people from a couple of people who said now that the hub's opening, they're going to be staying in the community longer.
In the township of Muskoka Lakes, there's one doctor. There's 6,700 permanent residents, but in the summertime with the seasonal people, it goes between 34 and 36,000 plus visitors.
And Port Carling is really the hub of the 3 major lakes, Lake Muskoka, Lake Rossa, and Lake June. So it's very centrally located.
The community see this as their community health hub.
The community has then been raising funds. To date, we have raised $1,800,000 towards the $2 million goal that we've set.
So we can provide all the services on the mobile health hub that you can access in your own primary care clinic. So all of the screenings, all of your annual health exams, any chronic disease management, We'll be having suturing, you can get blood work done here, and we'll be transferring it to the lab.
Well, I think having the health hub here makes people feel ownership, which is really important.
So it is really probably serving a need even beyond the medical, physical thing of a lot of social interaction. I like that.
I can't say enough about them. They feel for you and they help you like you were family.